Hi there, our highly valued, treasured and esteemed viewers and listeners, and welcome back to your channel of choice. This video I am about to present was compiled by Dr. Nath Arua, a clinical pharmacist by training and profession who is the founder of Progressive Pharmacotherapy Consultants, the premier virtual clinical pharmacy institute for capacity building for healthcare workers. The Virtual Clinical Pharmacy Institute with a difference, where patient safety, medication therapy management and optimal clinical outcomes are very crucial and non-negotiable to us. Here we seek to remain your premier source of crucial tips for high-impact pharmacotherapy services. So, on behalf of the Institute, I humbly urge you all to sit back and spare me part of your very precious time to share with you very useful tips which may prove very, very handy in your line of duty. I now welcome you all to part 554 of our pharmacotherapy series, which majors in schizophrenia. What pharmacologic agents should be considered first to treat JPJ considering her acute symptoms? In light of JPJ's acute psychotic symptoms and agitation, a combination of both antipsychotics and adjunctive agents should be considered at this time. Although antipsychotics are generally the mainstay of schizophrenia treatment, they may not reduce symptoms quickly enough. Benzodiazepines may also be useful, especially during periods of increased agitation. Use of adjunctive medications to treat any adverse effects, such as extrapyramidal symptoms, may also be needed. Depending upon JPJ's compliance to oral medications or during any periods of increased agitation, intramuscular injections of medications, including antipsychotics, benzodiazepines, and side effect medications, may need to be utilized acutely. JPJ is eventually stabilized on brexpiprazole 2 mg daily while hospitalized. During the admission, the staff notices that her psychotic symptoms have decreased, but that her agitation has slowly increased over time. She is constantly pacing around on the unit, and when she does sit down, she is always fidgety and unable to sit still. She says she feels uncomfortable most of the time. The unit staff have had to continue to give her lorazepam 1 mg several times a day for this agitation. What form of an extrapyramidal symptoms might JPJ be experiencing at this time? What information in her presentation supports this finding? JPJ is most likely experiencing akathisia. As her symptoms did decrease when brexpiprazole was initiated, it is unlikely that it is agitation due to her schizophrenia that is causing the restlessness. Antipsychotics, even those that are D2 partial agonists such as brexpiprazole, are known to cause akathisia as an adverse effect. Her symptoms also appear to be akathisia, constant pacing or movement, always fidgety, and feeling of inner restlessness. Although lorazepam would be expected to treat agitation, it is also a potential treatment for akathisia as well. What would be the appropriate treatment for JPJ's akathisia? First and foremost, it should be determined whether JPJ can be stabilized on a lower dose of her medication. Often a reduction in antipsychotic dose will resolve any extrapyramidal symptoms. If this is not possible and JPJ would destabilize as a result, then an additional medication will be needed to manage the problem. Although lorazepam would serve this purpose, the concerns about chronic daily administration of benzodiazepines must be considered. As JPJ may have akathisia with brexpiprazole as long as she is on the medication, she could require treatment for akathisia this entire time. Another option for treating this problem would be propranolol, the non-selective beta blocker. Propranolol has been found to be helpful in alleviating akathisia in low, subcardiac doses such as 10 to 20 mg twice daily. If this treatment is selected, then her blood pressure and heart rate should be monitored accordingly. When arranging her discharge, the pharmacy that is called for her prescriptions informs you that her insurance plan will not pay for brexpiprazole. What medication would be appropriate to switch JPJ to at this time? Ideally, we would keep JPJ on the medication that stabilized her during her hospitalization. It might be possible to contact her insurance to obtain a prior authorization for this medication. If that cannot be done, then they should be asked whether aripiprazole is available for use with JPJ. Aripiprazole is also a D2 partial agonist, like brexpiprazole, so theoretically it should work in a similar manner as brexpiprazole. If her insurance will not pay for aripiprazole, then another atypical antipsychotic with a similar adverse effect profile should be considered. As brexpiprazole has lower rates of extrapyramidal symptoms and metabolic adverse effects, an agent such as ziprasidone might be considered as it has similar rates of extrapyramidal symptoms and metabolic effects, but is available as a generic medication. So there you have it, our highly esteemed viewers and listeners. That brings us to the end of this video. If it benefited you in any way, kindly remember to give it a thumbs up, to like it and to share it widely with your peers. Please leave your comments at the bottom, and if you haven't yet done so, I humbly urge you to subscribe to our YouTube channel. I would like to promise you all that the very, very best is yet to come. Thank you very much for viewing this video. On behalf of our senior colleague, Dr. Nath Arua, I sincerely appreciate your partnership, continued support and kind collaboration. We look forward to interacting with you in the next video, which will be part 555.